Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. My affectionate students, today I am going to discuss about a topic that is routes of administration of drugs. Drugs can be introduced into the body by various ways and means, but it can be categorized in a nice way that it can be by local routes, it can be by systemic routes. Local route means drugs applied locally, and drug will not be absorbed to blood or systemic circulation, so systemic fluid of distribution. And systemic means drug will be, whatever may be the route, drug will go to fluid of distribution, systemic circulation. And there is another route is TDS, transdermal delivery system, which will be discussed later on, inshallah. One by one, we have to discuss. First thing is local routes. Local routes, drug applied locally, that is either onto the skin or on mucous membrane, maybe on conjunctiva, maybe on nasopharynx, maybe on ear, maybe on skin. That is application of drug onto the skin or mucous membrane. This is local, also it is called topical route. In this type, drug will be applied at that region and will not be absorbed from the, will not cross biological membrane and will not the systemic circulation. Its action will confined locally. There are various preparations that can be used for local route, maybe in the form of drops, maybe in the form of ointment, maybe in the form of cream, maybe in the form of lotion, maybe in the form of powder. These are the various forms by which ointment, cream, drop, in this way it can be used locally. But and there is systemic circulation, which is a systemic routes, which will be again divided into two. One is enteral, another one is parenteral. Enteral means enteron route. Enteron means it is concerned with GIT, and under this banner there will be oral route, buccal route, sublingual route, and rectal route. And in case of parenteral means beyond enteral route. Here there is inhalation and injection. Injection may starts from intradermal, then subcutaneous, then intramuscular, then intravenous, then intraarterial, then intraarticular, then intraspinal, then epidural, and intraperitoneum. There are so many routes. And among the systemic route, whatever may be the route, drug will cross biological membrane and go to the systemic circulation. Now, among the enteral routes, I am coming first the enteral route, and the most important route is oral route. Oral route is the commonest route, the cheapest route, easiest route, convenient route. It is suitable for all age, except infant. It is suitable for all ages, especially young adult. It is a very convenient route, easy route, safe route, cheap route. And drugs in this route needs not to be given in purest form. And self-medication is possible. Self-satisfaction is there. An ambulatory patient, those patients can move, those patients in the classroom, on journey, ambulatory patient, they can utilize this route. This is a very simple route, needs no assistance, and it does not interfere with the personal life, personal activities of that individual. But these are the benefits, but there are some disadvantages of this oral route. Those may be missed, and after ingestion, this drug goes to the stomach, then intestine, then gut wall, then portal system to liver, and finally it reaches systemic circulation. So it will take some time, long time, maybe 1 hour, maybe more than that, to reach the systemic circulation, to reach the site of action and to get the beneficial effect. Moreover, food interferes its absorption, and there will be drug destruction in these different ways while taking this route. And irritant drugs, foul smelling drug, pungent smelling drugs cannot be given by this route. Patient of unconscious patient, that drug, this drug cannot be given. There uncooperative patient, there are many patients who do not like to take drug orally. And there are some drugs like polypeptides, like insulin, like glucagon, like ACTH. They are polypeptides. These drugs cannot be given orally. Then penicillin G cannot be given orally, which will be destroyed by hydrochloric acid. All catecholamines cannot be given orally. Then morphine, pethidine, nitroglycerin, these drugs cannot be given orally. So if these drugs is given orally, drug will be destroyed in stomach, in intestine, in gut wall before reaching to systemic circulation. A drug while taking orally and drug destruction at different routes while before coming to systemic circulation, maybe in stomach, maybe in intestine, maybe gut wall, maybe liver. This phenomenon is called hepatic first-pass metabolism or first-pass metabolism or systemic elimination. This type of drugs, those drugs I mentioned earlier that cannot be given orally because of their certain reason. Penicillin G destroyed by HCl. Then polypeptides will be destroyed by proteolytic enzyme. Heparin, another drug heparin, cannot be given orally. It has very strong electronegative charge. So it cannot, it's polar drug, water soluble, lipid insoluble, cannot be absorbed from the gut. All catecholamines will not be absorbed from the gut because it will be destroyed by monoaminoxidase enzyme in the gut wall and also in the liver before the COMT, before reaching to systemic circulation. Morphine, pethidine, nitroglycerin, they will be also destroyed in liver before reaching to systemic circulation. These are the limitations of oral route. Now sublingual route is also suitable route, is also used for emergency purpose. This in oral route action onset of action will be delayed, and how much amount of drug will reach systemic circulation we cannot say. But in case of sublingual route, the amount of drug is less, and this drug almost completely absorbed. That buccal circulation is more, goes to the systemic circulation, and immediate action of drug occurs. And drug destruction drug destruction by first-pass metabolism will not occur. This is an immediate action produces, but irritant drugs cannot be given by this route. And after nitroglycerin, nifedipine, this drug uses sublingually. And nitroglycerin, when used for anginal pain, pain subsides, is still drug under the tongue, we can spit it out. These are the benefits. But if large amount of drug cannot be given, and there will be increased salivation, which may dilute the concentration of the drug. Then buccal route, this drug given within the cheek and teeth, vitamin C can be used by this route. Another route is rectal route. Rectal route, in rectum there is circulation is of two types. Upper rectum drained to portal system by superior hemorrhoidal vein, but lower rectum drained to systemic circulation by middle and inferior hemorrhoidal vein. If this route is suitable for extreme of age, infants, babies, and extreme of age, they do not need privacy. That's why this route is suitable for extreme of age. Usually paracetamol, in the suppository form we use paracetamol suppository, then indomethacin suppository can be used in this diazepam suppository can be used. And if it gives in upper rectum, goes to the systemic circulation, goes to liver, and some amount of drug will be destroyed. But in lower rectum, drug will reach to the systemic circulation. But here fecal mass is there, So this fecal mass may interfere this type of absorption. And this route is suitable for local problem. If there is any local ulcer, inflammation, then piles, hemorrhoids, fissure, then this route is suitable. This local route is suitable and suitable for extreme of age, too elderly and too infant. Now this is about more or less enteral route. Now parenteral route. It means beyond enteral route. That means here two things important is inhalation and injection. Now inhalation route, it is this route inhaled, drug is inhaled through the respiratory tract, and this route is concerned with the respiratory tract. Here drug will be deposited on the respiratory tract. If the size is bigger, then upper respiratory tract. If the size is medium, then middle portion. If the size of the drug is smaller, then it will go to the alveoli. And in this way, it will remain in the local respiratory tract. Systemic absorption is almost, it will not occur usually, but there may occur, but usually this is a local route and action confined locally and action is immediate. That's why salbutamol can be used, ipratropium bromide can be used by this route, and they will produce immediate benefit in case of bronchial asthma. Then beclomethasone, fluticasone, these are used by inhalation route as an inhaler. And in this route, there is the technique is a bit difficult for someone, and it is expensive route, but it acts. It is immediate route. Action is very immediate and prompt, and systemic adverse effect usually does not occur from this route. Now we are going to about parenteral route. Parenteral means we are going to about injection route. And injection starts from intradermal to finally epidural route. In intradermal route, this is not widely used. This is limited use in case of skin test. In case of vaccine, BCG, then we use this route. Very little amount of drug is within the dermis. Now there is sublingual route. This route is common and drug given under the skin within the subcutaneous tissue. Subcutaneous tissue is less vascular area. From here, if drug is injected under the skin within the subcutaneous tissue, less vascular area, so drug will be absorbed slowly, and slow and sustained absorption and slow and sustained effect will be produced by this route. In this route, we use injection. We can use insulin can be used by this route. Adrenaline can be used by this route. At the same time, heparin can be used by this route, and their action will be slow but sustained. But here, the irritant drugs, toxic drugs cannot be given, and the amount of drug will be minimum, will not be more less than 2 ml can be given. Volume should be less than 2 ml. Now about injection, IM route. There are some advantages of injection IM route, and there are some disadvantages for injectable routes. Advantages is directly drug goes to the systemic circulation, and immediate onset of action is immediate, and the amount of drug will be limited, and drug destruction in stomach, in intestine, gut wall and liver will not occur. That means first-pass metabolism will not occur, and immediate action will be produced. But here, this is an emergency route. In case of acute emergency, we prefer this route. But here, self-medication is may or may not be possible. In subcutaneous injection, self-medication possible, but in case of IM injection, it is very difficult to inject by individual himself. And as so second man is necessary, and when the second man is necessary, it is expensive. He will charge something, so this is expensive, and it needs strict sterile precaution. It leaks needle, gauze, bandage. So it is an expensive procedure, and there is chance of injury to the muscle, injury to the nerve, injury to the bones, injury to the vessel will occur. But it is an emergency route. It is suitable for injection. It is suitable for it is suitable for emergency. Now there is intravenous route. Here directly drug goes to the systemic circulation, and blood can be given. IV glucose saline can be given by this route. Thiopental sodium can be given by this route. Here self-medication not possible, and a skilled hand is necessary to inject this drug, and drug injection should be slowly, otherwise that may affect the heart. So this is emergency route. It is suitable for acute emergency condition. In this we can use saline, we can use infusion by this route. Then intra-arterial route. Artery lies deep to the veins. That's why skilledness is more important here, because drug has to be given in arterial route. It is a bit difficult. It is not common. It is very difficult. So expert hand is necessary, and it is used for diagnostic purpose as well as for treatment purpose. Diagnostic purpose is local radiopaque dye should be given close to the tumor area, in the arteries close to the tumor area, and then radiopaque shadow will indicate the location of the tumor. Hysterosalpingography can be done, and then for treatment purpose it is also useful, because in case of treatment of cancer, cancer drugs are very dangerous drugs. They will destroy the normal cells in addition to cancer cell. But we want cancer cell destruction, but we don't want normal cell destruction. But irrespective of that, cancer cell will destroy normal as well as anti-cancer drug will destroy normal as well as cancer cell. So this drug should be given as close to the as close possible to the tumor cell. That's why nearby artery, drug will be injected, anti-cancer drug should be injected close to the artery, supplies that tumor, and it will produce local effect. Now there is also intra-articular injection, where this local problem, rheumatoid arthritis or any problem in the joint, then we can use drug within the synovial, within the joint space. But it is very difficult. Skilled hand is necessary, and strict sterile precaution is necessary. Otherwise, there will be infection and will do harm. It will do harm. It is beneficial if it is used properly and with strict precaution. Now, intraspinal route and epidural route. These are the routes used. Intraspinal route. Here, this route is suitable for infection of the cerebrospinal axis, meningitis. In this situation, we can use this route. And also epidural route is also, we use local anesthetics to produce localized regional anesthesia. We can utilize this route. So these are the different routes with their benefits. Here, which route should be chosen for which patient? This is very important. So criteria or guideline for selecting routes is very important for us. And there are some criteria, there are some guidelines which will decide which route should be selected. And first is physiochemical properties of the drug is very important. If the drug is polypeptide, this drug cannot be given orally. If the drug is heparin, this drug cannot be given orally. If the drug is irritant or pungent or foul smelling, these drugs cannot be given orally. So this is an important factor. If we give polypeptides, it will be destroyed by proteolytic enzyme in the gut. If we will give heparin, it will not be absorbed because of its charged nature. Also, it is a mucopolysaccharide. It will be destroyed by carbohydrate and protein splitting enzyme. So these drugs, nitroglycerin cannot be given because of its fast metabolism. Penicillin G cannot be given. Nitroglycerin cannot be. Penicillin G will be destroyed by HCl, and nitroglycerin will be destroyed in the liver. So physiochemical properties is very important in determining the routes of drug. Then age of the patient is very important. Age, extreme of age, I mentioned earlier, for the extreme of age is route, preferred route is rectal route, because from them privacy is not a factor. Otherwise, and for infants, local route, skin is more hydrated, and this skin topical application of drug is also suitable for infants below 1 year to 2 years of age. This route is also suitable. For young adult, the common route is oral route. Is oral route. And emergency situation, condition of the disease. If it is emergency, then emergency route, like injection route, like inhalation route. And if the case is chronic one, then the route will be oral route. Oral route is preferred. But here the site of infection is very important. If the infection is on eye drug can be applied on eye. If the infection is on the skin, drug can be applied on skin. If it is in ear, drug can be applied in ear. If it is in buccal, if it is in pharynx, drug can be applied on the pharynx or oral cavity. But if it is bronchial asthma, then drug can be given by inhalation route. And if it is in the gallbladder, if it is in kidney, this route is not approachable. So site of infection, and as well as whether it is approachable or non-approachable. If it is approachable, then appropriate route should be used. If it is not approachable, then we have to think about the situation is severe, acute or chronic. If chronic, then the oral route is preferred. And if it is severe, then the injectable route should be preferred. Injectable means IM may be preferred, IV may be preferred. Then is state consciousness of the patient or unconscious of the patient. If the patient is conscious, then the preferred route will be oral route. If the patient unconscious route, then the injection route is allowed. And inhalation route, here the unconscious patient, it has one which is voluntary component, one is involuntary component. Voluntary component cannot be utilized, but involuntary component can be utilized by inhalation route. As for example, a baby, unconscious baby suffering from respiratory difficulty, maybe due to bronchial asthma, if it is placed in spacer, the breathing oxygen can be taken. So voluntary component, though there is off, but the involuntary component will be there. So these are the things, the guidelines. Once again, the guidelines are physiochemical properties of the drug, then age of the patient, then severity of the disease, then site of infection, whether and the site is approachable or non-approachable. This should be considered. And the first pass metabolism is very important in this chapter. So the important things of this chapter to be remembered is the types of types of administration and advantages and disadvantages of each route. Another thing is the first pass metabolism is very important, and name few drugs which cannot be given orally with regions. This is very important. And lastly, TDS, transdermal delivery system is very important. By this route, we can apply patches on the skin, and through the membrane to the skin, drug will be absorbed, goes to the systemic circulation and produce desired effect. By this route, we can use nitroglycerin, we can use fentanyl, we can use hyoscine patch are available. We can use Ocusart patch. Ocusart, use this Ocusart patch tagged to the inner lead, and will from that patch drug is releases pilocarpine and reduces intraocular pressure. Similarly, from fentanyl, it is used to reduce pain, very excellent drug to reduce pain. And in case of cancer pain, intractable pain will occur. And as cancer is not curable, but intractable pain, to produce relief pain and to produce palliative effect, we can use fentanyl patch. It is available, it can be used as a bracelet, it can be tagged on the arm, and from that point drug will be goes to systemic circulation and produce its analgesic effect. Similarly, if we use nitroglycerin patch, this nitroglycerin patch will goes to the systemic circulation, will produce venodilatation, will produce arteriodilation, decreases preload and afterload, and relieves anginal pain. Similarly, there are the hyoscine patch. Hyoscine patch contains hyoscine butyl bromide. It is used in case of seasickness, when sailors on board will remain in the sea for several months, and the most important problem they will face, that is seasickness. To counter that seasickness, there is belt of hyoscine patch will be tagged on the arm, and from that patch slowly releases hyoscine butyl bromide, goes to the systemic circulation and produce anti-motion sickness effect. So this is a new technique, and this TDS, transdermal delivery system, also utilized in massive inoculation. So these are the routes, that is local routes, systemic routes, and transdermal delivery system is very important. And also important is the phebatic fast-pass metabolism. Name the drugs which can undergo phebatic fast-pass metabolism with regions in each case, and advantages and disadvantages of certain routes, especially oral route. So once again, oral route is the safest, easiest, cheapest, convenient route, and ambulatory patient can utilize this route. Thank you for your patient hearing. Assalamu alaikum wa rahmatullah.